I need to tell you something that took me years of medical training to fully understand, and something that, as a son, keeps me up at night worrying about my own parents. Last year, my 72-year-old mother called me after her annual checkup. Her doctor had recommended 4 different vaccines in a single visit. She said, "The doctor says I need all of these. Should I get them?" And my answer surprised even her. I said, "Mom, do not get all of those. Not yet. Not like this." Because here is what most people do not know. Vaccines are not automatically safe for everyone at every age. The immune system of a 70-year-old responds very differently to vaccines than a 40-year-old. And certain vaccines, when given to seniors over 60, can trigger reactions ranging from severe inflammation to dangerous immune responses. Some can even make the very condition they are supposed to prevent worse. Today I am going to share the 5 vaccines I would personally never allow my own parents to receive without serious discussion, careful evaluation, and in some cases, outright refusal. This is not anti-vaccine information, this is pro-senior information, and there is a very important difference. Stay with me. Hello and welcome. If you are watching this, you are probably someone who cares deeply about your health or the health of someone you love. Maybe you are over 60 yourself. Maybe you are an adult child trying to navigate the complicated world of senior healthcare for your aging parents. Either way, I am glad you are here, because what I am about to share is information that rarely gets discussed openly, not because it is a secret, but because our healthcare system often moves too fast to have these nuanced conversations. Your doctor has maybe 15 minutes with you. They are following guidelines written for the general population. But you are not the general population. You are a specific individual with a specific health history, specific medications, and specific risks. And after age 60, those specifics matter more than ever when it comes to vaccines. Now, I want to be crystal clear before we begin. Vaccines have saved hundreds of millions of lives. They are one of the greatest medical achievements in human history. I am not here to tell you vaccines are bad. What I am here to tell you is that certain vaccines carry specific risks for people over 60 that are not always communicated clearly. And as someone who loves their parents and understands medicine, I believe you deserve to know all of it. So let us go through all 5, starting with one that is routinely recommended, but carries a risk that most seniors never hear about. Vaccine number 1, the annual flu vaccine using the live attenuated version. Now, before you turn this off, hear me out. I am not saying seniors should skip flu vaccination entirely. The flu can be genuinely life-threatening for people over 60. What I am saying is that there are different types of flu vaccines, and one specific type carries risks that most seniors are never warned about. It is called the live attenuated influenza vaccine. Live attenuated simply means it contains a weakened but still living version of the flu virus. This version is given as a nasal spray rather than a shot. You might have seen it at pharmacies marketed as the nasal flu vaccine. Here's the problem. The CDC and the Advisory Committee on Immunization Practices both explicitly state that the live attenuated flu vaccine should not be given to adults over 50. Yet every single year, seniors walk into pharmacies and receive it simply because they asked for the flu vaccine and were not told there were different options. The weakened live virus in this vaccine can sometimes cause flu-like illness in people with weakened immune systems. And as we know, the immune system weakens significantly after 60. What is the right flu vaccine for seniors over 65? It is actually the high-dose flu vaccine, called Fluzone High Dose, or the adjuvanted flu vaccine called Fluad. These are specifically formulated for older immune systems. They contain a higher dose of the flu antigen, or an immune-boosting ingredient called an adjuvant. Studies show that the high-dose flu vaccine reduces flu-related hospitalizations in seniors by up to 25% more than the standard dose. So the action step here is simple. When you go for your flu shot, do not just say, "Give me the flu vaccine." Say specifically, "I want the high-dose flu vaccine for seniors," or ask for Fluad if you are over 65. And if anyone tries to give you a nasal spray flu vaccine, politely but firmly decline and ask for the injection instead. This one conversation could make a significant difference in both your protection and your safety. Vaccine number 2, multiple vaccines given simultaneously without evaluation. This one is not about a specific vaccine. It is about a practice that has become dangerously common in senior healthcare, the practice of stacking multiple vaccines in a single visit. Let me paint you a picture that many seniors will recognize immediately. You go in for your annual physical. Your doctor, following standard guidelines, recommends you are due for your flu shot, your pneumonia vaccine, your COVID booster, and your shingles vaccine, all at the same time. And you think, well, getting it all done at once is efficient, right? For a healthy 35-year-old, maybe. For a 72-year-old taking 4 prescription medications and managing 2 chronic conditions, this approach can be genuinely dangerous. Here is why. Each vaccine triggers an immune response. Your immune system has to mount a defense against each one simultaneously. In a young, healthy immune system, this is manageable. But in an older immune system, especially one already taxed by chronic illness or multiple medications, receiving multiple vaccines at once can trigger what researchers call immune overactivation. This means your immune system goes into overdrive, trying to respond to multiple challenges at once. The result? Severe fatigue that lasts weeks rather than days, high fever, significant inflammation throughout the body, in some cases, a temporary but serious worsening of existing conditions like heart failure, arthritis, or autoimmune disorders. There is also the practical problem of not knowing which vaccine caused which reaction. If you receive 4 vaccines on the same day and develop a serious reaction 2 days later, your doctor has no way to identify the culprit. This makes future vaccination decisions much more difficult and potentially more dangerous. What should you do instead? Space your vaccines out. Request to receive no more than 1 or 2 vaccines per visit. Schedule them at least 2 to 4 weeks apart when possible. Keep a personal vaccination record and bring it to every appointment. And always ask your doctor, given my specific health conditions and current medications, which of these vaccines is most urgent right now? Prioritize based on your individual risk, not a standardized checklist. A good doctor will welcome this conversation. Vaccine number 3, the shingles vaccine Zostavax, the older live version. If you are over 60, there is a very good chance your doctor has recommended or already given you a shingles vaccine. And that recommendation is absolutely correct. Shingles is a reactivation of the chickenpox virus that lives dormant in your nerve tissue. After 60, the immune system weakens enough that this dormant virus can wake up, and when it does, it causes an intensely painful burning rash that can last weeks. In some people over 60, the nerve pain from shingles, called postherpetic neuralgia, can last for months, or even years after the rash clears. It is one of the most painful conditions in medicine. So yes, shingles vaccination after 60 is important, but here is where the critical distinction comes in. There are 2 shingles vaccines, the OLD one called Zostavax, and the new one called Shingrix. Zostavax is a live attenuated vaccine, meaning it contains a weakened but living version of the varicella zoster virus, the same virus that causes chickenpox and shingles. Zostavax is no longer recommended by the CDC as of November 2020. It has been replaced by Shingrix, which is dramatically more effective. Shingrix is about 97% effective in people aged 50 to 69. Zostavax was only about 51% effective, so why am I listing Zostavax as a vaccine to refuse? Because despite CDC guidance, some healthcare facilities, particularly smaller clinics and some pharmacies, still have old Zostavax stock, and some seniors, particularly those in rural areas, or those seeing older providers who have not updated their practices, are still receiving Zostavax. Additionally, Zostavax being a live vaccine carries an additional risk. In people with significantly weakened immune systems, which includes many seniors over 75, especially those on immunosuppressive medications, for conditions like rheumatoid arthritis, the live virus in Zostavax can actually cause a shingles-like illness rather than prevent it. The action step here is straightforward. If someone recommends a shingles vaccine, confirm it is Shingrix, not Zostavax. Ask specifically, is this Shingrix? Is this the 2-dose recombinant vaccine? Shingrix requires 2 doses given 2 to 6 months apart. If someone offers you a shingles vaccine as a single injection, ask questions before accepting. Shingrix is always given as 2 injections. I want to stop here for just a moment, because if you are over 60, or if you are helping an aging parent navigate their health care, what we are discussing today is genuinely important, not frightening, important. Knowledge is the most powerful tool you have in any doctor's office, and you deserve to have it. If this video is helping you understand your options better, please take a moment to hit the like button and subscribe to our channel. We publish new senior health content every single week. And please share this video with someone you love, a parent, a sibling, a friend over 60. This kind of information changes real lives. Now let us continue with vaccine number 4. This one specifically affects seniors who are already managing chronic health conditions, and it is one that very few people talk about. Vaccine number 4. Certain vaccines in seniors on immunosuppressive medications. This is perhaps the most important and least discussed vaccine risk for seniors over 60, and it applies to a surprisingly large number of older Americans. Many seniors over 60 take medications that suppress or modulate the immune system. These include medications for rheumatoid arthritis, like methotrexate, or biologics like Humira, medications for inflammatory bowel disease, high-dose corticosteroids like prednisone taken long-term, medications after organ transplant, and certain cancer treatments. The critical problem is this: any live vaccine given to someone on immunosuppressive medication can cause the very illness it is designed to prevent, because the immune system is too weakened to safely handle even the attenuated form of the virus in the vaccine. Think of it this way. Normally, your immune system looks at a weakened virus in a vaccine and says, "I can handle this, let me learn from it and build defenses." But an immunosuppressed immune system looks at that same weakened virus and says, "I cannot fight this at all," and the virus takes hold. This is called vaccine-associated disease, and it is a real and documented risk, which live vaccines are most concerning for seniors on these medications. The older shingles vaccine Zostavax, which we already discussed, the MMR vaccine, which covers measles, mumps, and rubella, the yellow fever vaccine, the live attenuated flu vaccine nasal spray, and the oral typhoid vaccine. Now, most seniors over 60 do not receive MMR or yellow fever vaccines routinely, but the situation changes if they are traveling internationally. Many travel medicine clinics follow standard vaccination protocols for travel without adequately screening for immunosuppressive medication use. A senior taking methotrexate for rheumatoid arthritis who wants to visit a country requiring yellow fever vaccination is in a genuinely dangerous situation if given a live yellow fever vaccine. What should you do? Before receiving any vaccine, give your doctor or pharmacist a complete list of every medication you take, including over-the-counter medications and supplements. Ask specifically, is this vaccine a live vaccine, and is it safe with my current medications? If you are on any immunosuppressive medication, ask your prescribing doctor, not just a pharmacist, before receiving any vaccine. And if you are planning international travel, see a travel medicine specialist who has your complete medical record, not just a general travel vaccine clinic. This single piece of information could prevent a genuinely dangerous situation. Vaccine number 5. Certain COVID-19 booster doses without individual risk assessment. Now, before I say anything further, let me be absolutely unambiguous. The original COVID-19 vaccination series saved millions of lives, including millions of seniors who were among the most vulnerable to severe COVID-19 illness and death. I am not questioning the value of COVID-19 vaccination. What I am raising is a more nuanced conversation about repeated booster doses in seniors over 60, without individual risk assessment. Here is the concern. As COVID-19 has evolved, and as the virus has become less virulent for most vaccinated people, the risk-benefit calculation for repeated booster doses has become more complex, particularly for certain groups of seniors. A growing body of research, including studies from Harvard, Johns Hopkins, and the Cleveland Clinic, has raised questions about whether repeated booster doses in some individuals might cause a phenomenon called immune imprinting. This is where the immune system becomes so conditioned to responding to a specific version of the virus from an early vaccine that it struggles to mount an optimal response to newer variants. Additionally, certain cardiac side effects, particularly myocarditis, which is inflammation of the heart muscle, have been documented following COVID-19 mRNA vaccination. While myocarditis is more common in younger males, it has been documented in older adults as well. And in someone over 70 who already has underlying heart disease, even a mild case of vaccine-related myocarditis can be serious. There is also the concern of repeated immune activation in very elderly or frail seniors. For a 65-year-old in excellent health with significant ongoing COVID exposure risk, staying current with updated boosters makes clear sense. For an 82-year-old who is largely homebound, has already had COVID-19, has had 3 prior vaccine doses, and has existing heart or immune conditions, the calculation is genuinely more complex. The question is not should this person be vaccinated. The question is, what is the optimal timing, frequency, and specific formulation of boosters for this specific individual? And that question deserves an individualized answer, not a blanket recommendation. What should you do? Talk to your primary care doctor, not just a pharmacist or a vaccine clinic, about your specific booster schedule. Ask, given my health history, my prior infection status, my current medications, and my actual exposure risk, what is the right booster schedule for me specifically? Ask about the most current updated formulation, and whether it covers the variants currently circulating. And if you have any cardiac history, ask specifically whether you should be monitored more closely following vaccination. This is not about refusing COVID vaccination. This is about getting the right vaccine at the right time, in the right way, for your specific situation. So now that we have covered the 5 vaccine situations that concern me most for seniors over 60, let me give you a clear practical framework for navigating vaccination decisions going forward. Step 1. Always bring a complete medication list to any vaccination appointment. Every prescription, every over-the-counter medication, every supplement. Step 2. Ask your doctor or pharmacist whether each recommended vaccine is a live vaccine or an inactivated vaccine. Live vaccines carry different risks, especially for seniors with weakened immune systems. Step 3. Request that vaccines be spaced out rather than stacked. No more than 1 or 2 vaccines per visit, with at least 2 to 4 weeks between appointments when possible. Step 4. For the flu vaccine, specifically request the high-dose or adjuvanted version designed for seniors. Never accept the nasal spray version. Step 5. For the shingles vaccine, confirm it is Shingrix, the 2-dose recombinant version, not the older Zostavax. Step 6. If you are on any medication that affects the immune system, consult your prescribing specialist before receiving any vaccine, especially live vaccines. Step 7. For COVID boosters and any other frequently updated vaccines, have an individualized conversation with your primary care physician about timing and formulation based on your specific health situation and exposure risk. And finally, keep your own personal vaccination record. Write down every vaccine you receive, the date, the specific brand and formulation, and any reactions you experience. This record is invaluable for future healthcare decisions. Before I close, I need to say something directly and clearly. Everything I have shared today is about making vaccinations safer and more effective for seniors, not about avoiding vaccines altogether. Flu kills tens of thousands of Americans over 65 every year. Shingles causes devastating pain that can last for years. Pneumonia remains one of the leading killers of elderly Americans, and COVID-19 continues to pose real risks to older adults. Vaccines remain one of the most important tools we have for keeping seniors healthy and out of the hospital. What I am advocating for is informed, individualized, thoughtful vaccination, not blanket acceptance of every recommendation without question, and not blanket refusal either. You deserve to understand what is going into your body. You deserve to have your specific health situation considered. And you deserve a healthcare provider who welcomes your questions and gives you real answers. Let us quickly recap the 5 vaccine situations I would personally address very carefully for any senior over 60. Number 1. Avoid the live attenuated nasal spray flu vaccine. Request the high-dose or adjuvanted injection, specifically designed for seniors. Number 2. Refuse multiple vaccines stacked in a single visit without individual evaluation. Space them out by at least 2 to 4 weeks. Number 3. Decline Zostavax, the old shingles vaccine. Insist on Shingrix, the newer 2-dose recombinant vaccine. Number 4. If you are on immunosuppressive medications, never receive a live vaccine without explicit approval from your prescribing specialist. Number 5. For COVID-19 boosters, insist on an individualized conversation with your primary care doctor, rather than following a blanket schedule. Armed with this information, you can walk into any doctor's office or pharmacy with confidence. You can ask the right questions, and you can make decisions that are truly right for your specific body, your specific age, and your specific health situation. To every person watching this who is navigating healthcare after 60, whether for yourself or for someone you love deeply, you are doing the right thing by seeking information, by asking questions, By refusing to simply accept whatever is placed in front of you without understanding it, that is not being difficult. That is being a responsible, empowered patient. And to the adult children watching who are trying to protect their aging parents, I see you. I am one of you. And the conversation I had with my mother about her vaccines, it led to a better, more personalized vaccination plan that her own doctor ultimately agreed was the right approach for her. Advocacy works, knowledge protects, and love motivates us to seek both. If this video gave you something valuable today, please give it a thumbs up. It helps our channel reach more seniors and families who need this information. Subscribe to our channel and turn on notifications so you never miss our weekly senior health videos. And please share this video with someone you care about, a parent, a grandparent, a sibling, a friend who is over 60. This information could genuinely make a difference in their health and safety. Drop a comment below and tell me, has your doctor ever recommended multiple vaccines in a single visit? Did you ask questions, or did you just go along with it? Your experience might be exactly what someone else in our community needs to hear. Thank you so much for watching. Stay informed, stay empowered, and I will see you in the next video.